Everything you need to know about a blighted ovum. Welcome to my YouTube channel. This is Alema Health Matters. Is this your first time? I urge you to subscribe to my YouTube channel, like this video and also share. You can also comment on the comment section and share your views about this video. Don't forget to click on the bell so that you will be notified every time I upload a new video. This episode objectives are: what is a blighted ovum? When does a blighted ovum happen? What are the symptoms of a blighted ovum? What causes a blighted ovum? How is a blighted ovum diagnosed? How is a blighted ovum treated? And lastly, how long does it take to recover from a blighted ovum? A blighted ovum, also known as an embryonic pregnancy, is a type of early miscarriage that occurs when a fertilized egg implants into the uterus but does not develop into an embryo. The embryo will stop growing, but the gestational sac, that is where the embryo would develop, continues to grow. The placenta and empty gestational sac will release pregnancy hormones even without an embryo present. This causes you to have early symptoms of pregnancy or even have a positive pregnancy test. Sometimes it occurs so early in pregnancy that you don't know you are pregnant. When does a blighted ovum happen? A blighted ovum causes an early miscarriage in the first trimester of pregnancy. During fetal development, a fertilized egg turns into a blastocyst at around 4 weeks of pregnancy. This blastocyte implants in the wall of the uterus and develops into an embryo. When you have a blighted ovum, the gestational sac that would hold the embryo continues to grow even without an embryo present. The following can occur. A blighted ovum happens so early in pregnancy that you never realize you are pregnant. You have a positive pregnancy test and signs of pregnancy only to discover a blighted ovum at your first ultrasound. You have a positive pregnancy test and signs of pregnancy, but then experience a miscarriage. What are the symptoms of a blighted ovum? A blighted ovum can occur so early in pregnancy that you never knew you were pregnant. In other cases, you may experience signs of pregnancy, such as a missed menstrual period or a positive pregnancy test. You can have symptoms of early pregnancy, such as breast tenderness and morning sickness. Other times, your symptoms will resemble those of a miscarriage. Vaginal bleeding, that is spotting, light bleeding, bleeding or passing light gray tissue or blood clots. Cramping, mild to moderate cramping in your pelvic and abdominal region. The only way to confirm a blighted ovum is through an ultrasound. It will show a gestational sac that is missing an embryo inside. What causes a blighted ovum? A blighted ovum is usually caused by chromosomal or genetic problems during cell division. During conception, the egg will begin to divide shortly after being fertilized by a sperm. Around 10 days later, the cells have formed an embryo. With a blighted ovum, the embryo never forms or stops growing after it's formed. A blighted ovum miscarriage will cause vaginal bleeding and abdominal cramping. A miscarriage usually feels more intense than your regular menstrual period. You can take over-the-counter medicine to relieve the cramping. Avoid lifting anything heavy or any strenuous exercise as it can increase your bleeding. You may experience spotting for several weeks after miscarriage. How is a blighted ovum diagnosed? Your healthcare provider will diagnose a blighted ovum using a transvaginal ultrasound. This happens in the first trimester, usually between 7 and 9 weeks of pregnancy. An embryo should be visible at this time in pregnancy. With a blighted ovum, the gestational sac will be empty. People are often unaware that they have a blighted ovum. This is because your placenta continues to give off hormones, making your body think you are pregnant. This is also why you can still have symptoms of pregnancy, including a positive pregnancy test. If you've already experienced bleeding or signs of miscarriage, your healthcare provider will use ultrasound to look at the contents of the uterus to diagnose a blighted ovum. How is a blighted ovum treated? For some people, there may be no treatment needed because your body passes the embryo through your vagina through a miscarriage. If your body does not miscarry the embryo, there are other options to remove the contents of your uterus. Your healthcare provider will talk to you through possible treatments like dilatation and curettage, D&C. This is a surgical procedure to remove the contents of your uterus. Number 2 is natural miscarriage. If it's safe, you may be able to watch and wait to see if your body eventually releases the pregnancy tissues. It can sometimes take days or weeks for this to start. You will experience cramping, abdominal pain, and bleeding once the miscarriage begins. Number 3, medication-induced miscarriage. You may be given a medication called misoprostol to trigger your body to miscarry. A follow-up appointment is usually scheduled 4 to 6 weeks after a miscarriage or a D&C. You may be given another ultrasound to confirm the uterus is empty. Your healthcare provider will check for signs of infection and make sure there are no complications. How long does it take to recover from a blighted ovum? Recovering from a blighted ovum miscarriage can last from 1 or 2 weeks to a month. Cramping generally lasts up to a week, but bleeding can last several weeks. Your bleeding should get lighter until it stops completely. You can resume normal activities when you feel comfortable. Bleeding can increase with strenuous activities or exercise. Hormones may remain in your body and delay your menstrual cycle. Most people will get their period within 4 to 6 weeks after a blighted ovum. It may take longer to recover emotionally from a blighted ovum miscarriage. You may have feelings of sadness, anger, or confusion. It's okay to take time to grieve. Ask your friends and family for support. That is the last part of this discussion. I urge you to subscribe to my YouTube channel, like this video and also share. You can also comment on the comment section and share your views about this video. Don't forget to click on the bell so that you will be notified every time I upload a new video. Thank you so much for watching.